Greetings. I'm Dr. Aldrich Chan, neuropsychologist and psychotherapist in Miami, faculty at Pepperdine University, and the founder of the Center for Neuropsychology and Consciousness. Welcome to the CNC Dialogues. My next guest is Dr. Edward Shafranske. He's a professor of psychology, Muriel Lipsey Chair in Clinical and Counseling Psychology, and director of the Psy.D program at Pepperdine University. He's published widely and conducts clinical research in the fields of clinical supervision and the applied psychology of religion. Dr. Shafranske is a board-certified psychoanalyst and has published over 75 articles, chapters, and 10 books, is a member of 8 editorial boards, and maintains a clinical practice in Irvine, California. Dr. Shafranske is recognized as a fellow in 3 divisions of APA and the International Psychoanalytical Association, and twice served as the president of APA Division 36, Society for the Psychology of Religion and Spirituality. As a bonus, he was one of my supervisors during my time at Pepperdine University. He was a fountain of wisdom, knowledge, humility, and an inspiration. In today's discussion, we begin by exploring the differences between religion and spirituality. We subsequently dive into the science behind their relationship to mental health. We follow by investigating its relationship to positive psychology before entering deeply into its connection to psychoanalysis and how psychoanalysis may interpret or approach religion and spirituality. We talk about God concepts versus God representations, how early childhood experiences may reflect our relationship to the transcendent, and even touch on mystical and religious experiences. The work of Christopher Bolus and Wilfred Bion, amongst others, are also included, and his own reflections on themes within this transcendent dimension of experience. We then touch on suggestions for clinicians who may be interested in incorporating this domain into their work. Finally, we end with some rapid-fire questions to better acquaint ourselves with who Dr. Shafranske is as a person. If any of these sound interesting to you, feel free to skip around. Hi, Ed. How are you?
I'm fine, and it's really great to see you, Aldrich. Thank you so much for the invitation for us to have this conversation together and to share it with colleagues around the world.
Absolutely. Thanks so much for joining. Okay, so before diving in, why don't we begin by defining some terms like what is the difference between religion and spirituality?
Well, that's a great question. I think the challenge is this has kind of been bugging us forever. So that there are about 109 definitions of religion. And so there's many years ago, Zinbauer and colleagues who studied this with Ken Pargament said, this is like fuzzy. These are really kind of fuzzy concepts. But I would say generally what we see is that religion is more anchored in institutional affiliation, institutional forms of worship, ritual practice, and so forth. Obviously, there's oftentimes a codified set of beliefs and moral prescripts and, scripture and so on and so forth. Spirituality, on the other hand, tends to be much more idiosyncratic. It tends to be highly personal. And what some of the research shows is that if you ask people how they see it, there's a percentage that see themselves as religious and spiritual. And I think the group that's really interesting are the people that are saying that they're religious, but they're not spiritual. So it's kind of all over the map.
Right.
And from a research standpoint, Harold Koenig and others who have done a lot of research in this area in terms of relationship between religion and spirituality and health, say that spirituality is so difficult to actually operationalize and define that he sees from a science standpoint, it's not quite that useful. That being said, if you look at the Pew studies, if you look at the national studies, more and more they're discriminating from someone being religious or saying that religion is important versus those people that see spirituality as important. And there is a trend, and the trend line is away from institutional religiosity and more towards personal spirituality. One writer talks about that he actually sees spirituality as almost like a political kind of statement. It has to do with just positioning oneself to kind of authorize one's own beliefs in oneself rather than having it tied to an institution. That being said, if we go back and read William James, in his famous Varieties of Religious Experience. When you read how James actually talked about religion, it was very global. It wasn't very institutional at all.
Mm-hmm.
So it's kind of a curious thing. We've kind of started with James, which I think is seeing, as James said something to the effect, that what religion was a relationship with something beyond the self,
Right.
in terms of God. And so that many people would say that's spirituality today.
Mm-hmm.
So it's a great question. It's a good way for us to kind of start off. Is what are we really talking about? And for those who are clinicians, the important thing is when we're talking to patients and we're asking about their background that we use both terms.
Mm-hmm.
And we're open to the great deal of kind of fluidity in this, and so it's complex from a theoretical standpoint and also from a
Yeah.
research standpoint.
Yeah, important nonetheless, so that we don't get lost in semantics as we
Yeah,
move forward.
exactly.
But it sounds like spirituality is more about that personal connection. And I too have heard people say that they're religious but not spiritual, and religious to the extent that they want to continue the customs and they
Hmm.
don't want to lose the traditions involved,
Yeah.
but then they don't believe in anything greater. So
Yeah.
okay. So I know my audience is very interested in what I'm about to ask next, and that really relates to the quantitative research that's been conducted on the relationship between religion and spirituality, specifically, of course, in connection to mental health.
Yeah.
Could you speak to the state of that?
Yeah. I'd be happy to. There's been a terrific there's been an increase in scientific study about these associations and relationships, particularly over the past 20 years. Probably one of the most major studies was done by Harold Koenig, where he reviewed 3,000 empirical studies or articles.
Mm-hmm.
Um, and I've looked at that. I've looked at some of the meta-analyses. I think a general response would be that we know that religion and spirituality, and let me say this about the way the research is done, often, almost all the time, they're looking at religion and religion as an independent variable is really operationalized in very traditional institutional ways.
Mm-hmm.
For example, things like have have you gone to church, synagogue, or temple in the past 7 days?
I see.
So it's like, oh, well, what does that have to do with spirituality?
Right.
But
Mm-hmm.
so they're using these kinds of indicators, or they've used a scale, Ken Pargament's religious coping scale measure.
Mm-hmm.
Um, so that's probably the first place to kind of start,
Mm-hmm.
is that how the research has been conducted has been highly institutionally focused.
Mm-hmm.
And so I
Okay.
think there's some noise in that, because what
Mm-hmm.
really
Yeah.
matters is to what extent is religion and spirituality, however one defines it, integrated in one's life.
Mm-hmm.
That to me is really the key
Mm-hmm.
part. But
Mm-hmm.
going back to the research, it shows that there are moderate positive effects generally
Mm-hmm.
in the relationship between religion, however, rather religious involvement, however defined, and mental health outcomes, again, however defined.
Mm-hmm.
So definitely that's where the trend line is. But it's we can't, as always, you can't make you can't make a comment about a specific through a generality. So that
Mm-hmm.
the other thing that we know is that, for example, if you look at anxiety, there's the results appear to be divergent in many ways. So exceedingly complex is probably a better way to say it. So people that have a strong internalized sense of God, and which is related to attachment, those people that have that solid relationship with God, if that's how they perceive the other, as it were, that for those individuals, religion and spirituality and their investment in it actually will moderate anxiety, and in fact will have positive impacts. On the other hand, you can just imagine you have the opposite side.
Mm-hmm.
You have people that have had negative religious experiences, people
Mm-hmm.
that
Yeah.
the underlying experience of God is a God that's chaotic, a God that's not consistent, a God that's punitive. Not surprisingly, when they're dealing with difficult times, as they relate to God, it actually increases anxiety. And
Interesting.
that's similar to depression. One area where people have looked at pretty carefully recently has to do with the relationship between religion and spirituality as a resource in terms of trauma.
Mm-hmm.
And again, there's great variability, but I think what is kind of fascinating is the majority of people that have suffered from trauma, they actually maintain their religious beliefs. They maintain the beliefs,
Mm-hmm.
but there's variance in terms of how they might use those beliefs or how they might use religion. Um, it reminds me of a study a colleague of mine did many, many years ago, probably 40 years ago, where he was studying the children. No, he was studying Holocaust survivors in New York City.
Mm-hmm.
And he found something very interesting because they were, by and large, they were culturally identified with the Jewish faith, and many were quite conservative in that.
Mm-hmm.
And when he interviewed them, yes, they believed in God. Yes, they believed in the religious traditions in which they were raised. But the majority said, I believe in God, but I don't love God.
Mm.
Which is like a powerful, to me, that was like opens the
Yeah.
door to the complexity of this, that people can have beliefs, people can have relationship, but it isn't always positive.
Right. Have there been any studies that looked into? So the general trend, as you mentioned, is that if somebody is religious, it does seem to lead to greater levels of well-being. Let's say, right?
Yeah.
And of course, we can't account for all the individual differences. But I am curious: have studies found differences between different types of religions and the
Yeah.
different effect sizes, or is that something that's ongoing?
Well, they keep trying, they keep trying, but again,
Okay.
I think where the noise is institutional affiliation.
Yeah.
Again, I think is kind of problematic for looking for a deeper kind of clinical psychological understanding. It has to more to do with the integration.
Right.
Um, I know it's been attempted. I don't believe that the research has come in any way kind of
Hmm.
definitive. And I'm kind of
Hmm.
reminded, we'll go back to William James. He said, the issue always is, well, which religions are healthy and which religions aren't? Is this a good congregation or not?
Mm.
And, what James said is, well, he used the analogy of fruit dropping from a tree. He said, that's really what you want to look at he didn't say it quite like that. Of course, he was much more articulate, but the notion being, and I think from a clinical or an individual standpoint, to see, well, what's the functionality of religion in any given individual's life? That's really
Hmm.
the core piece. Now, I
Hmm.
will say I've looked at some of the research that Van Kepelen and other people have done that is quite fascinating because they're saying in certain kinds of religious traditions, they through the rituals they may actually how can I put this? They provide context in which there's a creation of positive affect,
Mm.
as we're building kind of a positive affect, and this gets into this notion of building competences inside, so that from an emotional standpoint, so those religions that create situations where there's heightened positive affect,
Yeah.
not surprisingly, that will have impacts on mental health.
Hmm.
And if you're in a congregation or in a community, a faith community, I should say, that supports your values, your virtues, how
Hmm.
you live a good life, that also provides increased support.
Hmm.
So, in the best of circumstances, in that kind of environment, one's mental health would be stronger.
Right. Do they bolster or empower your aspirations and what you're aiming towards?
Yeah,
And in that regard, I thought we could just touch on positive psychology just a little bit.
yeah,
And I want to delve deeper, of course, into psychoanalysis. But I know that positive psychology plays a role, and there's a connection there as well. And it sort of reframed the question of what is wrong, right, to what works or what is right or what's improving.
yeah,
And I think it's a nice sort of segue. Maybe you could speak a bit to that.
yeah. I'd love to. Yeah, with Marty Seligman's work, that really begins the whole movement in positive psychology. And as you put it well, it's rather than looking at deficit, rather than looking at psychopathology, why don't
Hmm.
we look at thriving? Is the term that often is used. Why don't we look at capability and adaptability and health? And I think he's had a terrific impact, and people in
Hmm.
that field have a terrific impact that kind of broadens the lens of psychology. And then as clinicians, it provides a nice balance between, again, a deficit psychopathology model to a model that looks at health and the farther reaches of health, as Maslow coined that phrase. So again, so one of the things we know, I talked a little bit about religious involvement may, in fact, in the most positive contexts, has the potential to increase positive emotion, to provide emotional and community support, to reinforce positive values, and so forth. And so that can lead to mental health outcomes.
Yeah.
And beyond just, absence of mental illness, but more on this other curve in terms of thriving. Also, I think the virtue research is really fascinating. When people are living according to certain core values and virtues and are sustained in that, they tend to live more of what people have talked about as a good life, which gets into values.
Yeah.
What essentially is a good life. And again, all religions have notions of that. All religions provide that. Even spirituality in itself, even in its most idiosyncratic forms, people are trying to figure out, what's this life mean? As Frankl certainly talked about, the search for meaning. But that, so both institutional and all the way through, there's a striving to try to understand, how am I going to live a good life?
Yeah.
And that can be anchored in religious beliefs and can be anchored, again, within communities. I think this is the part that oftentimes we forget about, that communities, whether it's the community within a family, in a neighborhood, in a congregation, whatever, that can be really sustaining and kind of uplifting and provide support during rough times and so forth. See, what else do I want to say about positive psychology?
Could I throw something in here?
Yeah, please.
Just with this discussion of virtues, I think it was Aristotle who actually stated that that underlying all virtues is the necessity for self-control. And there is some research by, I think it was Roy Baumeister, if I said that correctly,
Yes.
that supported this statement. And I'm curious to hear from you the connection between how religion and spirituality may bolster self-control.
Yeah, that's a really it's a sophisticated question. It's an important question. So, what's all religious groups have, of course, a moral code. And if we think of it from the most positive sense, or we think in terms of a virtue orientation, it goes right to, what's a good life? So of components of good life, for example, would be temperance, would be enjoying the best of life, enjoying the pleasures of life, but not being so seduced by just the hedonic kind of pleasures of life, that there's more to life in that sense. So it's those virtues that kind of play off of each other that leads us to some degree of control. Now, oftentimes when people think of religion, they think of, or when they think of control, they think of control in a negative way. It's controlling impulse, it's being punished, we have to, have rigid control. But that isn't really what Baumeister or others have talked about. They really talk about how within the context of virtues, one controls not for the sake of some fear, but one controls because one has had an experience of other virtues. One has had the experience of relating to the world with themselves, with their own needs, in ways that are positive. So probably, an example would be, like even something like healthy eating. Healthy eating isn't resisting against pleasure. It's deriving pleasure in a way that is balanced in the sense of, so I think even Baumeister or others, really talk about, and there's research to show, in fact, there's an interesting set of studies that were done by, I'm going to block on his name now, at UCSD, and they're looking at adolescents, and they find that that one of the functions, or one of the things that occurs for adolescents, is they're dealing with all kinds of drives, as we know, and all kinds of impulses, and that religion, and not surprisingly, affiliation with religious institutions provides a set of kind of it helps them to internalize some controls, so it's not just wanton kind of acting out, but it's also not shutting down impulse. It's not shutting down pleasure and desire. It's kind of seeing it within the context of other virtues and care, like care for another person, not using another person, but caring and being loving and having, relationship with another person. So maybe I went a little asunder on that, but
Not at all.
I
I
think,
think
yeah.
no. I mean, I think it relates to something that you wrote with. I think it was Rizzuto. The two of you talked about it as that it provides a moral scaffolding, right, to manage dysregulated impulses. And I do wonder, do you think it's the case that some people must find religion and spirituality in order to successfully regulate themselves? Because one could make the argument that without it, someone could simply fall into the hedonistic treadmill, chasing pleasures and avoiding pain. And
Right.
unfortunately, that doesn't, that ends up usually at a tragic end. So,
Yes, yeah. Yeah, exactly. Yeah, they end up in our office or someplace else, and
right, such as
and
addictions and so forth. Mm,
yeah. And let me just say something about Anna Maria Rizzuto. I think, for people who don't know her, she's someone to read. If any of you have interest in the psychoanalytic understanding of religion or the psychoanalysis and Freud, Dr. Rizzuto is a psychoanalyst, originally from South America, from Argentina, who practiced in Boston for many years. She was a psychiatrist and a psychoanalyst who I had the great fortune of meeting early in my professional career. I had read her works
mm,
and really had the pleasure of knowing her. So if any of you have interest, I would definitely suggest you read some of her work.
mhm,
Um, so what Dr. Rizzuto and I were writing about, and it gets to your question, again, it has to do with the degree of the integration of religiosity or faith. So I would say there's like a continuum. For some people, the integration is really still at the level of fear,
mhm,
of a lot of social controls.
mhm,
And so it provides a scaffolding that I would say relies more upon, and this is actually Freud commented on this. Freud wasn't entirely against religion. He was against the fact that in part, I don't want to simplify Freud, but in part, Freud's concern was religion was playing into the structure of the superego and so forth, and so decision making was based more on unconscious neurotic factors, superego factors, fear of loss of love, and so forth. So it kind of worked against rationality, against a kind of a thoughtful decision making, and I would say value. Freud didn't talk about this, but more of a values based decision making in terms of how one lives one's life. So at the most, I would say superficial level, and I don't mean that in a derogatory way. I mean it more as a description.
yeah,
So it's really at the level of behavior, behavioral consequence, fear, and so forth. But nevertheless, there's a structure.
mhm,
Nevertheless, there's a that will help, and infrastructure. But over time, again, if we're integrating values, if we're integrating and we're being thoughtful about our lives and learning from life experience and learning from relationships, that becomes more and more integrated. So we're acting well, not out of fear. We're acting well because we fundamentally know this is good for us and good for others, and
mhm,
this is the highest point of the fullness of being a human being,
right,
in the world.
mhm,
But yeah, but that scaffolding plays a huge role. I mean, that we get that scaffolding starts when we're children,
mhm,
and it just builds and builds, and institutions, of course, work with it. But to me, the hope would be that the outcome of that, the deeper kind of, it's a scaffolding, but what becomes deeper is, again, one's own kind of self-reflective capacity,
Mm-hmm.
and expanding relational capacity
Mm-hmm.
will lead us to this. Of course, we
Mm-hmm.
have people that are antisocial. We have people that are psychopathic.
Mm-hmm.
And there, of course, what you see are people, they know the rules, but they don't have really an internalized sense of morality.
Mm-hmm.
And we see the consequence of that, sadly.
Right. So I wanted to pivot a little bit here,
Yeah.
still focusing on the work of you and Rizzuto. And but the two of you placed religion and spirituality as a transitional realm
Yeah.
of experience. And I'm wondering if you could elaborate on that.
Happy
What is
to.
that?
Yeah, so this is built, on Winnicott's understanding of transitional space or transitional objects.
Mm-hmm.
And it's a wonderful space. Particularly, we see it most clearly in younger children. When a child is playing, for example, with a doll,
Mm-hmm.
um, it's quite real. That's a very real object to that child.
Yeah.
And yet, so in moments it's Barbie, and the next moment it's a doll, a toy you put away.
Mm-hmm.
And Winnicott, I think, kind of brilliantly put it. He says, you don't ask, is this experiencing coming from the outside, that being reality? Or is the object and this experience coming from the inside, that being fantasy? So there's a suspension of the demarcation between reality and external reality, empirical reality, as it
Mm-hmm.
were, and internal states, which would have to do with fantasy, particularly within the psychoanalytic realm. So what Dr. Rizzuto and I, were writing about, and what others have written about within this kind of narrow field of the psychoanalytic study of religion,
Mm-hmm.
is that when we think of God, first of all, we think of God representations
Mm-hmm. Mm-hmm.
rather than God images or God concepts. And in the psychology of religion, people have studied God concepts,
Mm-hmm.
which are very cognitive. Is God loving? Is God just? Is God kind?
Mm-hmm.
Very,
Abstract and
yeah, it's
a bit
abstract.
detached.
It's
Mm-hmm.
not very alive.
Yeah.
More attributional ways of viewing it. So what Rizzuto and I and others have been looking at and have been writing about is what we're within the transitional space. God is a vital existence. But yeah, if you ask someone and their belief in God, they can be really clear and say, "Well, I believe in God, but I'm not exactly. Sometimes I'm not exactly sure,
Mm-hmm.
but I have a belief." And uh, the other aspect of the transitional realm is that there's again this suspending of the need to demark reality and fantasy,
Mm-hmm.
so that the God objects and God representations are such that they have terrific power to motivate us, to
Mm-hmm.
affect us,
Yeah.
because it's a real relationship, it's a real experience.
Mm-hmm.
Again, I didn't say it's. I'm not making a statement about the existence of God.
Mm-hmm.
That's beyond. That's above my
Mm-hmm.
pay grade. So
It's sort of suspended between the object and the subject in
right,
this sort of mix or blend. Yeah.
exactly,
Mm-hmm.
exactly, and that's where it has. Clifford Geertz, the anthropologist, said that religion has the capacity to inspire tremendous emotional experience, and that's what really is the key element.
Mm-hmm.
It's the feeling state of a relationship with the sacred or the beyond. So it's
Mm-hmm. Mm-hmm.
um, so that's kind of what we mean about
Mm-hmm.
transitional states,
Yeah.
and how God functions not as an abstract intellectual concept,
Mm-hmm.
but rather as something that, like all of our objects,
Mm-hmm.
we could. This is a little bit of an aside. In analytic thinking, when you think of the child's experience with the mother, well, it's not just the objective mother. It's the
Mm-hmm.
mother that it comes out of all these experiences
Mm-hmm.
of
Mm-hmm.
actual interpersonal action that are shaped, if you're analytic at least,
Right.
shaped by fantasy and desire and a whole host of things. And that's really
Right.
more what our how we relate in the world, where there's a
Mm-hmm.
high degree of subjectivity, and in the interpersonal realm, we say there's a high degree of intersubjectivity.
Yes. Yes. Now, related, Freud, he rooted God representations in pre-Oedipal dynamics, right? Namely, the belief that God is simply rooted in the child's helpless dependency.
Yes.
For him, God is a father substitute and a synthesis of related memories and inherited memory traces of the primal father to form the individual's idea of God. So,
Right.
what does he mean by the primal father? And secondly, your work tends to show this is no longer a sufficient response. Could you
Yeah.
respond to that as well?
Yeah. I think Freud had a fairly static view. I wish that Freud would have the language that you just shared so articulately. Even concepts of narrative,
Hmm.
or the constructions of narrative. Freud, of course, didn't think of those. I don't believe Freud had the opportunity to think about psychological processes quite in that way. So for him,
Mhm.
it very much was internalization processes that
Mhm.
were fairly static.
Mhm.
So that one's internalizing, the God represent, God. Which again flowed for Freud, flowed through specifically through the relationship with the father, the relationship with the mother. So it was fairly static. So
Mhm.
one was internalizing, these relationships and, as if they couldn't be modified, as if there wasn't more flow to them. So, and by the way, I don't disagree with all what Freud said. I think Freud's conceptualization is accurate,
Mhm.
but it's
It's
limited.
limited. Yeah.
It's limited. Exactly. It's
Yeah.
limited because
Mm.
the core principles he's talking about in terms of internalization, um, absolutely, I believe that. I think most of us believe that. So, but what Rizzuto particularly talks about is because now she's operating from an object relations framework to
Mhm.
a great extent, not a Freudian, a narrowly focused Freudian viewpoint. Is so there's an understanding that there's this admixture of fantasy and interactional
Mhm.
experience, which we might call, quote, reality.
Mm.
So all of that is going in, and it's a vibrant mix that's also being influenced by the kinds of need states we have at the given time also.
Mhm.
So that plays there's a very dynamic tension as these God representations are created. Let me
Mhm.
share with you a personal story that might that might uh, enliven this a bit, and I don't mind sharing it. I remember when I was a boy, and I was probably 9 or 10 years of age, and my family went to Coos Bay, Oregon,
Mm.
and we went on a little fishing trip, or at least supposedly it was going to be a fishing trip, and we got out in the channel, and there was all of a sudden there was huge storms that came up, and we had to get back. We had to get back to the harbor, and
Yeah.
we're going back, and we're seeing and I'm young, but I'm still hearing what's going on. There's almost no one on this boat. There's the captain and my family, and all of a sudden we see Coast Guard cutters, and we see a Coast Guard ship, I should say, and we hear them saying almost like a Mayday. It's like
Mm.
we're taking
Yeah.
on water, and there's these huge redwood uh, uh, logs.
Hmm.
They were larger than this little boat,
Right, I imagine. Yeah.
and and that was probably my most dramatic experience of God, when
Mm.
I absolutely was praying for God to save me. So there's that admixture of desire, of fear,
Mhm.
that then called up all the religious beliefs and training I had received. But in that moment, that was a dynamic God representation.
Hmm.
As I look back at it. Of course, at
Mhm.
the time, I wasn't using language like that. I was just
Right.
wanting to be saved. I was wanting to have us get out of the boat. So hopefully
Mhm.
that illustrates a bit that it wasn't quite so, I would say, narrow focused the way Freud kind of put it. It's all these kinds of experiences
Mhm.
that influence our God representations, or our representations of the sacred throughout life.
Right. Excellent. Thank you for sharing that story. Definitely brought imagery and bring things to life. Um, so psychoanalysis is interested very much so in the sources of meaning making, right?
Yes.
And we can view religion and spirituality as perhaps a meaning making process or meaning making systems. And much of the time with analytic work, these sources tend to be linked to attachment, right? Early childhood experiences, primary caregivers. Um, we might think of the quality of the relationship that maybe leads to, if we think about attachment terms, right, avoidant attachment or preoccupied or disorganized and so forth. In your own work, do you find that those types of relationships people have to their primary caregivers tend to reflect quite similarly to their relationships with the transcendent?
Yes. It's almost a one-to-one relationship. It's a
One to
good
one.
question. You're tapping on, some important research that's been done over the years where there's a direct link
Mm-hmm.
between
Mm-hmm.
types of attachment, and God representations or experience of God. So, not surprisingly, if one has secure attachment, um, which really shapes all of our relationships. So it's kind of logical. So it's just,
Mm-hmm.
if it's shaping all of our human relating, it's shaping also our relating to whatever we conceive of the transcendent. So that for those persons, their God representation, their gods are in fact secure,
Mm-hmm.
secure, consistent. They can use them in such ways. The obverse is also true that if one has disorganized attachment, similarly, that there's a circumstance where then the God, that the transcendent that they relate to, is also held in a disorganized manner.
Mm-hmm.
I can recall a patient I treated many, many years ago, and obviously I'm not going to share any identifying information.
Of course.
But this patient, it was during my training actually, and the patient would fluctuate between a great devotion, a reverence, and for God, and actually derived what they experienced as terrific sense of security and warmth in moments of prayer and so forth. And then a week later, it would be fear and damnation, and there's no God, and
Mm.
the patient was doing the same thing with me. One day I was wonderful, and the next day I was the worst person on earth.
Right.
So what you're tapping into, I think there's abundant empirical research as well as clinical research, that helps us to see that link is there. And to me, it really makes sense that, that attachment patterning is so deeply woven into us that,
Right.
of course, it would influence the way we
Mm.
hold one's gods and so forth. And it's also kind of interesting as we can see for some patients, for some people, that their religious involvement is really kind of a desperate search for that secure, consistent relationship with God.
Mm.
And they can go through prolonged periods and maybe their whole life, which would be wonderful.
Mm.
Really feeling that this is the one relationship in which there's security, there's abundant love, there's
Mhm.
abundant understanding, um, that supersedes all human understanding, and that's
Mhm.
kind of an interesting notion. Will God
Right.
be? But
Yeah.
thank goodness, thank God, that I
Yeah.
have these experiences.
Mm. So, it does come to mind for me a curious question. I don't know if there's anything out there on this. I'm sure you would. But if we're speaking about people with secure attachments who have this consistent, stable relationship with the divine or the transcendent, and if we think of a preoccupied person, perhaps having a bit more instability, a sort of love-hate relationship, or disorganized, it being disorganized, when someone is avoidant, um, what would that reflect?
Oh,
Could
that's
could
interesting.
could that relate to someone who's a staunch atheist, completely closed to the possibility of a god, or is it more so? Is it different?
Well, I think you've just identified a great dissertation topic.
Okay.
I'm not. I know the general research in that area. I don't know if they've looked at that about in terms of, let's say, someone holding atheist who is an atheist.
Hmm.
Of course, what's quite interesting is some of the studies of atheists. Of course, it doesn't suggest that they don't have God representations.
Hmm.
it's just intellectually but they're at, they have, intellectual reasons to a great extent, and sometimes reasons based on, experiences within organized religion that
Mm-hmm.
lead to disavowal.
Mm-hmm.
So yeah, I don't know what the research has been there, but there is now a growing body of research
Mm-hmm.
on those that do not hold a faith perspective.
I
That's
see.
kind of also the kind of missing piece,
Mm.
is we haven't taken those we haven't really taken those persons seriously. Well, I
Mm-hmm.
shouldn't. We just haven't looked at it empirically.
Okay. So let's talk a little bit about some of the activities people might engage in, who are religious, such as prayer. Um, what would prayer signify from a sort of psychoanalytic perspective, or in conflict resolution, these sorts
Yeah,
of things?
yeah. Well, just a couple of things. I think it was kind of interesting. I think it's almost 70% of Americans pray regularly.
Oh, wow.
So this is kind of an interesting window also. No matter what they believe, rather where they do research where we're looking at rates of institutional involvement. But I
Mm-hmm.
always found that kind of a profound one, because that says something. It means you really have to believe something. You really have to have a psychological belief
Mm-hmm.
system to pray, in
Mm-hmm.
my own view.
Right.
So I think from a psychoanalytic standpoint, we would say, and let me just, I probably should have said this at the beginning, that of course as psychologists or as psychoanalysts, we have no, we really can't answer the question of existence. We can't,
Mm-hmm.
that, so we have to be humble in that sense.
Mm-hmm.
And we also have to be careful to not be so reductionistic. So in this podcast, in our conversation, I'm looking at very complex personal experiences of people. I'm kind of reducing them to psychological frameworks, and
Right.
I
Mm-hmm.
just want to be humble about that. It's like, yeah, we're that. For example, let's look at prayer. Since you asked, for some people, the experience of prayer is really in being in a state of communion
Mm.
with a highly personal person in their life. God, who they might call that experience. And so somehow we have to honor that as a very unique, authentic experience, even though we start applying psychology to it and we start saying, oh, well, this is dealing with an internalized psychological object.
Mm-hmm.
We're
Mm-hmm.
kind of stripping out the human, authentic experience of the person.
Right.
I
Right.
just want to hold that. Also, it's
Yeah.
reminding me of, I think it was Philip Rieff, the philosopher, writer, who said, someone asked him, well, is it true or not true? And he said, well, the only answer I have is it could be true and it could not be true.
Mm-hmm.
So that's the positioning I think is probably useful to be in. But let me answer your question. So, first of all, we know that for some people, prayer really has profound effects. One of the effects is this connection with something transcendent beyond them that can be emotionally quite vital.
Mm-hmm.
And there's different forms of course, prayer. There's prayer that's really where one is asking for intercession in life experience. Please take this away from me, this kind of thing. Please
Yeah.
cure me.
Yeah.
These are so there's that element of it.
Mm-hmm.
There also is kind of celebratory, prayer of praise, which is once again highly emotional experiences. So from a psychoanalytic sense, of course we're gonna reduce it to, well, what are the psychological phenomena? What are the antecedents of this experience? And so then we go back into Rizzuto and others' work to think about, well, these are transitional objects, these are transitional experiences, um, these are made of psychological experience, that come from our lives.
Mm-hmm. Mm-hmm.
But then there are other people who have commented on this. So there's, I hope I can recall his name, very fine psychoanalyst from Israel. Hopefully it'll come back to me. But he had an interesting critique. He said, in all the theory building, What they left out is what is an actual God that actually is speaking to people, is actually changing their lives.
Hmm.
So that's kind of been missing in the system, has been an actual God. Taking a perspective of saying of thinking of this as reality,
Mm-hmm.
and an actual God who is intervening, who is answering one's prayers. So again, it's this tension between reducing it to simply psychological human phenomena and holding it open, to the fact that again, we have no privilege to
Mm-hmm.
say whether this is all psychological phenomena.
Hmm. So, my next question then relates actually more so to religious experiences and mystical experiences. I think those are obviously quite fascinating
Yeah.
for many reasons. I think that it was Freud I think it was in The Civilization and Its Discontents where he spoke of or was responding to someone who was speaking of these oceanic feelings.
Yeah.
And he sort of talked about it more as a regression. Are you in alignment with that, or where do you
I
stand?
mean, yeah, it's regression's an interesting phenomenon. I mean, the language of it sounds has a certain pejorative kind of ring to it, like let's become more primitive. We're
Hmm.
regressive. Yeah, you're referring to Romain Rolland, who had correspondence with Freud, and it was interesting. Freud said in his correspondence with Romain Rolland, who was talking about this oceanic feeling, Freud said, "I never had an instant of that ever in my life." So it's like that just was not at all a part of his experience, or at
Hmm.
least what he wrote about,
Hmm.
or he declared it like that. Um, so is it regressive? Well, it depends what we mean by regressive, and it depends what we're talking about. So there is, as an analyst, I would say yes. It's regressive in this sense. There's a loosening of ego boundaries. So what we're seeing is ego functions are being suspended.
Hmm.
So there's a suspension, like one of the characteristics of many religious experiences is that there's a loss of a sense of time. There can be loss of a sense of place.
Hmm.
There can be a loss of a sense of identity in some unique instances.
Hmm.
Um, there's a profound emotional arousal that's quite unusual.
Hmm.
There can be a profound sense of unity, that so is it a regression again? But let's think of it not pejoratively, not becoming like childlike in a pejorative sense,
Hmm.
but more there is a regression in what we might think about as higher level ego functions,
Hmm.
reality testing, being oriented to time, place,
Right.
this kind of thing. So yes, I think that absolutely is happening. Now, but let me give another example
Hmm.
about and then I'll share a little story of some research I did many, many years ago. But if you think of like appreciating a piece of art, you can walk in there and look at a Matisse as an example, and you can intellectually figure it out, discern it. You can locate it in a given history. You can do a whole host of things. It's very intellectual, very abstract, and have an appreciation.
Hmm.
But I would offer, as someone who loves art, you're not you're not looking at a beautiful piece of art. Right? That to really appreciate Matisse or to appreciate that given painting, one has to suspend all that. So you're affected emotionally. You're affected by it. So there's a kind of regression, and there was in analytic thinking. There's Gilbert Rose wrote about this, and he talks about regression in service of the ego.
Hmm.
And Rose said, what happens is we regress in the like a painter regresses when they're painting. So they're immersed in what they're doing, and they're not so conscious of the decision making. But then what do? They step out, and then they pull it together,
Hmm.
as it were,
Hmm.
using higher ego functions,
Hmm.
and they make some decisions. And then what do? They go back into it.
Right. So
And I think,
it's
yeah,
no, I was just going to say and stress this that it's a positive and productive approach to regression, whereas most people think of it as returning to the primitive as a bad thing, or similar to or analogous to people thinking all stress is bad when some stress can be
Yeah,
actually helpful, or neuroplasticity being a good thing, but it can also be a bad thing, right? So regression is also one of those terms that has both sides, but it tends to be, at least people tend to focus on the negative end.
yeah,
Mm-hmm.
that it's a loss of function. Well, yeah,
Mm-hmm.
some would say, well, what's transcendent? The other, talking about religious experience, they say, well, okay, it's not so much regression, it's
Mm-hmm.
transcendence.
Right.
It's going beyond the ordinary,
Mm-hmm.
beyond the usual.
Mm-hmm.
And
Yeah.
I'll share a little story that illustrates part of this.
Mm-hmm.
Years ago, I was hired by a religious community, a church, to study the effectiveness of their worship and the effectiveness of what was happening in this particular church.
Mm-hmm.
So we did quantitative instruments. We also did interviews, and two things were fascinating. One is when you ask people in this congregation about their religious experiences, their spiritual experiences, there wasn't one of them that said that happened in a church. And this was very dismaying to the church who hired me. But I'll share this little example. So it was a beautiful story where a person, and once again, it was in a state of stress, and not unlike my experience in Coos Bay, Oregon,
Mm-hmm.
where he was on a boat, he was rowing, he was fishing, and all of a sudden these storms came up, and he told this beautiful narrative, the storms coming up, and all of a sudden he began to panic, he began to feel a great deal of anxiety, and he was rowing and rowing because the engine wouldn't turn over, and he could see the storm was going to envelop him.
Engulf them,
So
yeah.
there was fear. But what happened is, he said, in that moment it all lifted, and he felt a oneness in life. He said he felt
Mm-hmm.
a oneness with everything. He was completely relaxed, still was rowing,
Mm-hmm.
still, but he said there was like life. He said he felt like he was fully in life in that moment.
Mm-hmm.
And the last part of our interview question was, and what does this mean to you? And he said, I have never had fear ever again after that experience.
Fascinating. Wow.
So, regression in service of the ego, was that a
Mm-hmm.
regression?
Mm-hmm.
Was that, to me, it was a heightened spiritual experience. And
Yeah.
and
Mm-hmm.
there's research now. There's a lot of people that are exploring the use of psychedelics,
Psychedelics. Yeah.
psilocybin, and so, and there is research, and I don't really know much about this at all, that
Mm-hmm.
has to do with certain brain functions and spiritual experience related to certain kind of atypical seizures and other things. But,
Mm-hmm. Yeah, yeah. There's also research looking at flow states that's
yeah,
become more popular as well, and lots of the findings they're quite interesting. They'll ask like improvisation musicians to get into an fMRI, and they'll have them play a scale or something like that that requires intentionality, and then they'll ask them to improv, and they look at differences and what they end up finding. Yeah, we end up shutting down a lot of the higher cognitive faculties and allowing the bottom up processes of the subcortical regions to become far more salient,
mm,
while certain areas are still involved in the frontal lobes, but it's
yeah.
far diminished comparatively. Um,
And that's kind of a nice way to think of it. So it's not so much regression; it's we're using different capacities, brain
mhm.
capacities.
Yeah, different patterns of activation, different,
Yeah.
yeah, flexible ways of using our brain. Um, yeah, the only other thing I wanted to mention about that is it also reminds me of uh, a TED talk by Jill Bolte Taylor, where she talks about how she had a stroke in her left hemisphere. She's a neuroscientist, and after that stroke in the left hemisphere, she felt timelessness and boundlessness, and it's one of those really interesting experiences and anecdotes, given that it's coming from a neuroscientist who was so left brain, quote unquote, prior to, and realizing
Mm,
how much the right hemisphere could play a role. um, I wanted to now touch a little bit also, because people who watch the podcast, some are therapists, and something that's uh, quite an avenue of interest is the practice of confession,
uh-huh.
right? For those who are religious, and its relation to therapy. How do experiences of confession perhaps impact an individual's relationship to a therapist, and what's been your experience like there?
Yeah. No, it's a great question. There's an interesting study or book that was written by Jackson many years ago where
Mm-hmm.
he looked at the relationship between psychotherapeutic practices going all the way back into antiquity.
Mm-hmm.
So he studied the Greeks, he studied the Romans, and he said one of the elements, if I'm remembering this correctly, that one of the elements that you see all the way through what today we would use language like indigenous healing practices has always been confession, something confessional.
Mm.
It's getting, or in more common parlance, getting something off your chest.
Mm-hmm.
you know, uh, having that day where you're really confessing your own challenges, experiences, what you've done, what you haven't done, and so forth. So some have said that really is one of the major elements in psychotherapy. Perry London, probably in, again, probably 50 years ago, he said that, the psychotherapists today, let me see what exactly, that psychotherapists are the modern priests.
Mm.
He said they have supplemented, rather, they have taken that role of going to a confessor, being in some way accepted
Mm.
and blessed, and and go sin no more.
Mm.
I'll see you next Tuesday, but that
Right.
kind of thing.
Mm.
So that I think what you're touching on is, I think all of us as psychotherapists, we know the positive benefit for clients when they're actually able to tell us
Mm-hmm.
all that's happened to them, and also how they've lived their life in the world,
Mm-hmm.
things that they don't feel good about, and things they might have done differently, and that the experience, and I think this is a critical part that's interesting. It's more within certain religious traditions like the Catholic Church, where it's the speaking of it to, for example, a priest. It's speaking to it to another human being. It plays a critical role because we can all reflect on our own. We can all have those moments of um, contemplation, sorrow, regret. But to actually share that interpersonally is very powerful, as we all know as therapists.
Mm-hmm.
That that's where the healing really is mediated, I believe, not just by kind of an individual acceptance of oneself, but it's mediated within the context of a warm, empathic, understanding relationship.
Mm-hmm.
That's a very human relationship. So
Yeah.
so I think the
Yeah.
confessional aspects are core. And I found in therapy that you know, sometimes the breaking through, rather for some patients, it's being able to talk about that piece has
Mm-hmm.
been actually more important than other aspects of things that have been done to them and so forth. And being able to say, I did do this
Mm-hmm.
and I feel horrible about
Mm-hmm. Mm-hmm. Excellent. Thank you for sharing that. I want to touch a little bit now on the work of Wilfred Bion,
it. Okay.
who you actually introduced me to when I was under your supervision, and I've grown to really like his work, as you probably realized in my own book.
Oh, yeah.
So I
Yeah. Great.
so of course the concept of Bion I wanted us to touch on is term O, right? And his term O, for those of you listening, refer to ultimate reality, or he even called it the Godhead, or the unknown essence of experience. And it represents the thing in itself, or what is beyond representation, the thing that we've been talking about, what's beyond symbolization, that O can't be necessarily described, but nonetheless, it can really, at least it changed the way that he approached his own analytic work, right? Where now he approaches analytic work from a sense of complete openness to experience, without memory, without desire, and that can really lead to hopefully the realization of O to some extent, which in his mind transcends object relations. Are there parallels to your work here, or is this maybe where you might diverge with his work? What are your thoughts on this?
Well, thank you for bringing him up, bringing his ideas up, um, which are very difficult. I mean, he's difficult but brilliant, and but I would just say this: that in some respects, what he's touching on is, I think what's interesting is that in his system, in contrast with Freud, in his or psychoanalytic thinking generally, is that, although of course he's an analyst, was an analyst, that he's putting it as one of the basic desires of life. There's one of the basic components is to and in his concepts of K or minus K, of being curious, of being open, of that the mind is trying, we are trying to understand our existences. So where Freud didn't talk about that element so much in his cultural pieces, but so Bion opens that door to O, which I think is certainly much, he would see, I would imagine he would see, that when we are at a point where we're staying at the symbolism vis-a-vis, beliefs about a specific God in a specific space, that's kind of a place on the way to O.
Mm-hmm.
Because as you said, O is something that's undefinable, really. It's undescribable. It's some ecstatic state.
Mm-hmm.
So I draw upon, certainly Bion's work in terms of that. It's reminded me of, the other that's influenced me is Christopher Bolus talks about the unknown, the
Unknown
unknown.
known. Yeah.
And I've applied that work to my own understanding of God, and in terms of from an analytic standpoint, is that the search for the God or the experience of God doesn't come from nowhere. It's not born out of absence. It's actually born out of very early experiences as we begin to relate to those primal others who are taking care of us, our maternal object primarily and so forth. So I've talked about how, when one is reaching out for God, they're actually reaching out to, it comes from actual subjective experience, going from cold to warm, going from wet to dry, going from, frantically hungry to being satiated. That these are powerful experiences that are within us that we don't have, discriminate memory of, but are really at the core of attachment and so forth. So when I think about O, or when I think about the inclination towards O, I think or about God representations themselves, I kind of base it on that it's actually coming out of actual experience, subjective experience that has a validity in itself because it's been experienced, that then sets in motion our desire for a relationship with the other, or because I love Bolus's words on this, the unthought known. I can't think about a God. I can't describe that, but I know a God is there.
Yeah, it speaks very much to the implicit systems that they would use now and today that far outweigh the explicit or the conscious systems that we have. And there's all this debate about intuition, and things that we do know is that intuition is not blind, and it's very well informed, in fact.
I'd be curious about your own kind of playing in this territory and how you see it, because you have the wonderful neuroscience kind of background, and also in your book, whether there's anything that kind of leads to your own speculations about how religion or spirituality kind of functions, or is an epiphenomenon.
Now, I don't see it as an epiphenomenon. This actually is going to go back to even more basic, fundamental ideas, in the sense that it moves into the territory of metaphysics for me, at least from an intellectual perspective, because materialism today is currently being very much challenged. The idea that everything can be reduced to just matter, even though we don't fully understand what matter actually is. But there are other frameworks now that are joining in, or at least returning to the game, like idealism and panpsychism, and all of these. There are very robust metaphysical frameworks that actually can interpret and make sense of the science that's out there. And so I say that because when it comes to my own beliefs, part of it, what I believe based off of I would say a decent amount of intellectual rigor after all this examination of these frameworks is that consciousness is fundamental. And for scientists, some might say that consciousness would be uh, the way to explain what a soul might be, and
Mm-hmm.
that there are certain elements that may very much then relate to spirituality or to O. I mean,
Yeah.
it's very clear. I think all perception researchers would agree that we see just a tiny fraction of what's actually out there. Some say that we don't see what's out there at all. And they have the math to support their ideas, which is why they're not being laughed off of the stage, which I'm talking about Donald Hoffman.
Mm-hmm.
And so I'm very open-minded to that intellectual arena. At the same time, I've had certain experiences myself that had me, let's say, challenge all of the conventional ideas that I was typically inculcated into, especially working at hospitals and being friends with lots of atheists and so forth. And so, I try and match what well, let's say I could follow more of a pragmatic viewpoint here, following the ideas of William James here, that they've been very productive and empowering to my own way of being in the world. And so yeah, I mean, I'm open, very open to Owen. I really enjoy Bion's approach of entering a session without memory or desire, and in fact, suspending your preconceived, judgments and ideas about how the person may have differed or changed, and try to view every patient or client, whatever language is used these days, to um, see them anew, as if it's a new person coming in, and being open to whatever reveries
Mm-hmm.
might come into mind. So, and I allow my intuition to guide a lot of my work at this point, which has been great. Not that I've stopped reading tons of work, but I read as much as possible, and then I forget everything. I try and let it go.
So, so it's called wisdom, I think.
well, well, thank you so much. Um, so let me just say one more thing about Bion, and then we'll move from him, because I'm kind of interested about this whole atheism, uh, working with atheists, and Bion did also speak of negative capability, which is the ability to tolerate the pain and confusion of not knowing, right, rather than imposing these ready-made certainties upon an ambiguous situation, right?
Yeah.
And so again, I'm mentioning this because I wonder if you're working, let's say, with an atheist, and you've said atheists also have God representations, but they claim not to have any religion or spirituality. Could this become an avenue of focus, or would this negative capability be something that you would work on rather than other things, or is it different in some way?
Yeah, it's interesting. I mean, the initial, I haven't given it a whole lot of thought, but what strikes me is it's really how we hold our beliefs or how we hold our thinking about things, so that, because, I've met I haven't really worked with any atheists as I can think of where that's
Mhm.
become the focus of the treatment primarily, but
Yeah.
um, I think it's how we hold the beliefs because I certainly have met people that hold those beliefs and they can be adamant about it,
Mm-hmm.
certain. So I
Mm-hmm.
think what Bion was talking about was really that. Well, you said it perfectly. That it's really, can you deal with the discomfort? Can you deal with the pain of really not knowing? Can we enter
Mm-hmm.
into not knowing
Mm-hmm.
and embrace it? So I think that's true for anyone, whether that's a hardcore atheist versus someone who's an absolute believer in a particular religious system. That it's how they hold, it's how one holds one's beliefs,
Mm-hmm.
is the way I would kind of view it.
Mm-hmm.
So it would be interesting to study to try to get a sense of, okay, is it that people who are atheists, I would think would probably actually be more the group that are two groups. One would be one group that's been identified as agnostics,
Mm-hmm.
or the other group would be, in Ventus's system, would be questers.
Mm-hmm.
So there are some people that primarily their religiosity, spirituality are in what Daniel Ventus called quest, which is they're much more interested in the questions.
Yeah.
They're
Yeah.
engaged in the questions. They're curious. They're holding. It isn't that they dispute it doesn't mean that they don't have beliefs, but but behind a belief is another question.
Right.
to me, that's more of a
Mhm.
Bionian. These are social psychologists of religion, but that. Uh, so I think it has to do with to what extent we can hold complexity, to what
Mhm.
extent we can suffer with the not knowing.
Mhm.
Because again, if someone is adamantly for something and someone is adamantly against it, they're
Mhm.
both kind of the same
Yeah,
in the sense of the way
absolutely.
they believe. So I would, but it would be interesting to see if people who declare themselves to be atheists
Mm.
are how they, one has to do with complexity,
Mhm.
the other has to do with just, how one holds one's beliefs to be able to assuage anxiety.
Yeah, yeah.
What Bion's talking about. We hold on to belief, so that a mental construction. Like he said, from a clinical standpoint, the minute you make sense, then you've lost it.
Mm.
It's contained your anxiety.
Mhm.
Or Rizzuto actually said that to me when I first met her. I interviewed her. Boy, I don't want to say how many years; it'll really date me. But she, but at the end of an interview, I asked her. I said, "Well,
Mhm.
what advice would you give to a young kind of psychologist, has interest in this?" And she said, "Ed, don't make sense until the very last minute." And I've held on to that.
Right.
I have held on to that.
Excellent
And
advice. Mm.
is that nice advice? That's
Yeah.
that's very Bionian. Don't
Right.
the minute you make sense, you don't trust that. Don't trust that.
Mm. Mm. It reminds me of sort of the idea that when you ask a simple question and there's a simple answer, the question itself is no longer an important and meaningful question. But
Mm,
the most meaningful and deep questions are the ones that have multiple responses to them, or responses that continue to evolve with time.
yeah,
Because as soon as you give a firm answer, it's the death of a question. And perhaps it's an escape from some sort of anxiety or fear, and no
yeah,
longer an authentic or genuine way to try and respond. And so uncertainty itself keeps things alive. It keeps adventure alive, and it keeps you questioning and engaged in a quest for the so-called truth, right? So, yeah,
yeah.
excellent. Thank you. Yeah.
I would agree with you, but that would only be a matter of my trying to deal with my anxiety. So I'll say, no, I'm kidding a bit, but no, I absolutely agree. I think,
Hmm.
but that's also an interesting aspect because we're talking about religion and faith and that of, is does faith lead to the transcendent or does it actually um, prevent?
Hmm.
Because
Yeah.
the minute we hold on to a conception and invest in it, it does answer the big question.
Hmm.
It's kind of what you're touching on. So
Hmm.
if you answer the question, then you no longer have to ask the question.
Right. Do you distinguish, by the way, between faith and belief?
Yeah, that's yes. So beliefs are kind of they're well. I'm going back to I think it's Holt at Harvard, who is a scholar in religion or was a scholar in religion, and he said he didn't like the using the term faith. He didn't like using the term belief because it was too static.
Hmm.
He says that's really not what this is about. It's about faithing. In fact, he liked the verb.
Hmm. Faithing, yeah.
So it isn't that you have faith; it's that you're actively faithing in a given moment. You're constructing the given. So I like that dynamic feeling
Hmm.
about it.
Yeah.
Because it weds kind of intellectual conceptions and then the vibrancy. It's to me, it's a little bit similar between attitudes and values. So, you can have an attitude towards something, but not do anything about it. You can, I'm against prejudice. Okay, that's nice. But if it's a value, then you're acting on that
Hmm.
that attitude. So to me, it's the same way.
Hmm.
Well, I believe in God. Okay,
Hmm. So one's passive, the other is proactive.
one's passive, one's it's really in one's life.
Hmm.
And that's what certainly there are some groups that really do talk about this. They may use different language, but belief is no. It's not just I believe something. It has to be manifest in one's life. It's an animator.
Hmm.
It's and so forth. Which I think is the case.
Okay. Okay. Now, in your own reflections, I'm going back to one of your papers now. You note three interrelated themes that have influenced your own work: the dimensions of transcendence, religious narrative, and hope and compassion.
Yeah.
Can you speak to some of these themes and how they've impacted your work?
Yeah. Well, yeah, and another way to view it is, well, why did I get interested in this? Or what's,
Sure.
how does it animate it? And your questions are good. So transcendence. So where did I get curious about transcendence? Well, if we think of Bion, it would be just a spark in one's part of human existence,
Hmm.
and that was somehow nurtured in a variety of ways. So in my
Right.
own personal life, I was raised in the Roman Catholic tradition. I think there is a lot of powerful elements within that particular tradition, particularly as a young child, where emotional experiences of ritual, of prayer, and so forth led to a sense of the other,
Mm.
and that was culturally nourished or ordained within my family and so forth, so that and with another religious education and the rest, so that that sense of the other was built in for me. I rather was nourished. Um, uh, so I think, and then my study of religion played a huge role also,
Mm.
and my study of psychoanalysis. Some people say, "Well, how can you do the same?" I think, well, they are this. They aren't the same, but
Mm.
to me, they aren't so divided because it's really talking about a deep sense of what it means to be human, and what's the nature of our existence within the broader scope of things. So to me, those are I'm operating in the same kind of territory, just from different kind of perspectives.
Hmm.
The inner life or the transcendent life, to me, they're quite interspersed. Um, so, and I've found in psychotherapy, I had exposure to Rollo May when I was in graduate school, and
Mm.
certainly had read Frankel and had heard him speak, and so that whole tradition kind of kept alive in me that sense of the meaning, the way we create meaning.
Hmm.
And then as a psychoanalyst, that just got expanded, in terms of the meaning making, that we're always constructing meaning. We can't not
Hmm.
construct meaning of things, um, mostly unconsciously, but nevertheless. So that's been one of the themes. I think the other was God representations. Again, interested in, just as an analyst, of just the internal world of fantasy and how we construct objects, how we construct our world. Our human world is really you know a how we internalize and construct, how we're influenced by fantasy and desire and all that, and how that plays a rich role, and how we then project that on the external world. And certainly I see that as a clinician, how that occurs, and try to help people to have better understanding. And then the third piece is hope, which goes back to my own, I think, probably, a whole host of things,
Mm.
religious training at the base level, experiences at the base level, but
Hmm.
then intellectual pursuits and liberation and theology and studies in those kinds of areas that are highly personal but very meaningful to me. So to do all that together then leads to kind of like a theology of hope, or a real strong belief in hope.
Hmm.
And I think that's what therapists offer. I think when I work with a patient, I'm in some fundamental way they're coming because they've lost a sense of hope, or
Hmm.
they've it's fraying,
Hmm.
that life can be different, that their experience can be different, that so that I always see it as we kind of offering a sense of hope, not that I have power to change anything,
Hmm.
but of being with them in their struggles, and being with them and
Hmm.
offering a sense that we can, we have the possibility of of uh, of living a better and better life, and being more true to who we are. So
Hmm.
that's, that's uh, feels a little bit like a Hallmark card. I want to say it's much more sincere than that. It's just hard to put that in words. But
Yeah.
I think, and also being someone within the Catholic tradition, I think the idea of salvation, which is really fundamentally about hope, is really about transcendence from the present
Mm-hmm.
to something far greater and far greater than we have any way of conceiving.
Mm-hmm.
And our religious systems just try to help us to imagine, what life is and what the life, if there is a life after this,
Mm-hmm.
how that, or just what the nature of life is. So, and I'm kind of fumbling around. You're getting me into that Bionian, complexity of not knowing, being faced once again of, I want to give you an answer, but I'm also flummoxed by the extent of my not knowing.
Well, I asked you a question that could lead to a flood of ideas as well. It must be difficult to synthesize it all within a specified amount of time also. Um, so let me ask you a question that you asked Rizzuto way back when, and that is, for the clinicians watching,
Yeah,
um, what advice would you give them if they'd like to incorporate religion and spirituality into their own work?
yeah, thank you. I would say is holding the tent. First of all, being, as I'm sure everyone here would want to is trying to do this, is to be highly respectful of a person's construction of their own meaning in life. Um, to understand that whenever we try to understand someone through the lens of a psychologist, a clinician, a psychoanalyst, we're taking their authentic experience and we're somehow reducing it into the frames of mind that we're comfortable with.
Hmm.
So we've already used a certain privilege. I think we need to humbly hold that privilege and say,
Hmm.
okay, yeah, I am. And someone says, I'm having this experience of God. If I entertain in my mind, oh, that's that God representation, and that's related to the secure object, and that goes all the way back. I want to suspend that. I want to hold that and just say, wait a minute, be more respectful of their experience.
Hmm.
So I think we all hold, as therapists, we hold these tensions. So I
Hmm.
think number one is deep respect. Number two, I think would be that's related is to just be aware of our reductionism is not leading necessarily to reality.
Hmm.
It's just reframing, reconstructing based on our language systems and so
Hmm.
forth, which have a lot of privilege because we use a lot of multi-syllable words that somehow seems to have power. The third would be from a psychoanalytic standpoint, when a patient has associations about something has to do with religion or spirituality, I'm also hearing it from the lens of transference. I'm also hearing it, if someone is calling out to be understood by God,
Hmm.
I'm wondering, are they also asking that of me? Is this their way of saying, I'm not really feeling completely understood by you?
Hmm.
Um,
Hmm.
take this away from me. So
Hmm.
again,
Hmm.
holding loosely, good analytic principles, which is that there's multiple levels of reality at all times.
Hmm.
And
Yeah.
we have to I'd suggest, be respectful of that. Other things that just pop into my mind about from a clinical, advice to clinicians is to be very careful about imposing one's own worldview or beliefs on another person.
Hmm.
And it's subtle because I'm sure that all of you out there would say, well, what do you mean? I mean, would I tell a patient to do this or that? No, of course not. I get you. But it's more subtle.
Hmm.
One subtle aspect is, do you disregard when they bring up something having to do with religion or spirituality? That's like number one, you know? Like even when you do an intake,
Hmm.
do you include religion and spirituality as part of what you're asking about? And I don't mean something simple like, what's your religious faith? I don't mean that. I mean, do you really take it seriously? And if someone, it does not have a religion or spiritual involvement, that we have to be respectful of that also. So I think those are some of the things I'm thinking about.
Mhm.
The other would be to pay attention to spiritual struggles. This is an important area of research that sometimes people don't think about. So, for example, you're working with a patient who, let's say, a loved one, a child, someone has died and they're bereft and really struggling with that. Well, do you really have a wide aperture to see what that experience is? Is it just the event itself? But also to think about, well, what's the potential impact on their complete worldview,
Mhm.
on their sense of self in the world? And that often leads to spiritual struggle.
Mhm.
And also, those of you who do family work, or couples work, is to think about, there is research to show that when there's incongruence within a couple in their religiosity, spirituality, it can create a lot of tension. Often it's dormant, but it comes out in particular situations. So part of it is also to be kind of attuned to that. And maybe the last thing I'll say is just a reminder that as groups, mental health professionals are very different in their religiosity, spirituality compared to the general population.
Hmm.
And so just to be aware of that,
Mhm. Do
for
they tend?
example,
Oh,
go
sorry.
ahead.
Do they tend to be more religious overall, or
Well,
less?
the general pub. So I did a study. This is kind of dated now, but other people have replicated it. So, for
Oh,
example, if you ask psychologists,
yeah.
if they're religious or spiritual, particularly if they're religious, how important is religion?
Mhm.
Um, for psychologists, I recall about 44% at the time said that religion was very important.
Mhm.
At the same time, you look at the national demographics of Americans,
Mhm.
it was about 92%. So
Mhm.
we are very different. When you ask psychologists, for example, about spirituality, they end up being much closer to religion in terms of the general population. So
Mhm.
it's
I
just the
see.
main thing, just to realize we're kind of different.
Mhm.
Mental professionals are different. But unfortunately, we fall into the trap that all human beings do, is then we project it on everybody. We just kind of assume other
Mhm.
people hold things the same way we do, and
Mhm.
they don't. So that's
Mhm.
probably the other important takeaway.
Mhm.
So you may minimize the importance of religion in your life,
Mhm.
for example, and have a hard time understanding how vitally important it is,
In
for
sales.
a given client,
Yeah.
because it's so outside of your experience, or rather, or worse, it's something you
Mhm.
projected.
Mhm. Mhm.
So that would be the other thing I would say. But
Okay.
those that's some of the advice. But
Mhm.
I probably would go back to Rizzuto. I keep sharing what she said. Just make sense. Don't make just wait on making sense of it.
I
Be
think
open.
well, first of all, thank you for that clinical advice. That's great wisdom that you're dropping for everyone here for free, by the way. So that's wonderful that you're so open to sharing your knowledge.
Thank
Um, I wrote about something called the phenomenal and noumenal axis.
you.
Maybe too deep into philosophical terms, but basically, what I was suggesting was for clinicians that when we are with a client, that we all sort of have to become a little bit more agnostic in the
Mm,
sense of being able to suspend our own beliefs and be aware of it, of course, but also be capable of accepting the other person as they are and recognizing how important their beliefs might be for themselves. So it's very much aligned with
yeah.
some things
No,
you've said.
that's such an important point that you're bringing up, Aldrich. It reminds me of there's some literature where people have been advocating along those lines, but having to do with diversity.
Hmm.
And they have used a framework. They've talked about bracketing,
Right, is an
that you can
existential term.
identify and then bracket your beliefs. I actually disagree with them.
Hmm.
I don't think we can
We
bracket anything.
can.
I don't think we can say, okay, now I'm going to put it outside the room.
Hmm.
I think what's more helpful, and it's not inconsistent with what you were saying at all, I believe, is really we need to lean into it
Hmm.
rather than, I don't mean imposing it. I mean, we lean into it to not, because I think the mistake that sometimes in that literature where people have said is, okay, identify it, put it outside the room, and then it's not going to affect anyone.
Right. Yeah,
And I
that's
just think
that's not how it works.
uh, it's always a part of us. But I think, yeah, what you're sharing is really important, is but that's where intentionality. So I would agree with you. I think the one needs to be intentional to say, okay, I need to not
Mhm.
be an advocate, not be
Mhm.
a detractor. I
Mhm.
think what you're saying is to
Yeah,
be,
yeah.
yeah,
Absolutely. It's for me. It's sliding between the phenomena or the noumena, what
yeah.
lies beyond our perception and what we can perceive. Like where does this person lie and where do I lie? And it's a dance, right?
That's even a deeper answer to this question.
Okay. Well, Ed, we're at that 90-minute mark, and so basically, as is tradition for my podcast, I don't know if you noticed this, but I do ask rapid fire questions at the very end. And so I hope you're open to some of these questions, and afterwards we'll end for today. Okay.
Sounds good.
Okay. Wonderful. All right. So name a book you love.
Uh,
Everyone hates this question.
what came, well, I'll just share the association. The first association, it may have to do with too much loyalty, is I thought of Freud's works, to be quite honest. That popped out of me. And then, I love novels. I started my career in literature, and let me think of what I'm reading now. But anyway, I think the first thing that popped into my mind, so I'm going to trust it.
Okay. Name a source of inspiration.
You and others, students. I mean, you're no longer a student, but
Mm,
you inspire me by your interest and curiosity, and that's why I still love teaching. So
mm,
it's kind of a weird, maybe a strange answer, but that's
mm,
what's kind of inspiring, is because I'm more interested in the questions and
mm,
the whole process of engagement. So I'm
mhm.
not sure I answered your question, but it was rapid.
Okay, that's all right. Thank you so much. I'm humbled by that response. What did you want to be when you were a child?
Oh, it varied.
What was the first thing that you remember?
Well, what came into mind, yeah, and this was an early memory. Although at times, I fantasized about being a priest. I think that was probably one of them. But I love tennis, so I
Mm,
really, would have. I wasn't as my talent, rather my ambition outstretched my talent. But I think watching the beauty of really fine tennis players, I was really kind of inspired to that.
mm. Okay. What's your favorite type of music?
Oh boy, it depends on the day. Mostly, I'm going between classical and jazz.
Okay.
That's probably. And then if I'm by the pool, I'll turn on something really, you know, frivolous.
Okay. All right. Name something unique that most people don't know about you.
Hmm. Um, I'm quite introverted, actually,
Hmm. Okay.
because I teach and lecture, and
Mhm.
people say, oh, he's very, they wouldn't imagine I'm actually probably best when I'm in my own internal space.
Mhm. Mhm. Wonderful. Um, do you believe in God?
How do you define? How do you define it? Um, yes,
Okay.
of something transcendent. I'm skeptical that I fully. Well, I'll just leave it at that.
I mean, is it the idea that you're skeptical in the belief of a God that we know every single angle of and
Yeah,
understand?
it's more that. Yeah, I have
Right.
a sense of belief of that there is something certainly well beyond us, but
Hmm.
in the spirit of beyond. Um, I kind of like some of the conceptions that
Hmm.
were part of my religious tradition. Would love to hold on to those, and I respect people that do.
Hmm.
But there is another part of me that says I think there's more. There's likely much more to this
Hmm.
than what I can ever fully understand.
Yeah, it's an encompassing mystery.
Yes, yes.
Um, do you believe in aliens?
No,
Okay. Would you say the universe is meaningful or meaningless?
it's in the eye of the beholder.
Okay.
I think it's I think it's a personal construction of meaning. So
Mm.
it But that gets into the fundamental question, right? When
Mm.
you say, is there God?
Mhm.
So it all goes back to, meaning, God. Is there something beyond something that was just inconceivably? I mean, how do we imagine non-being to being? How does that work?
Yeah, yeah. I know from the Eastern traditions that nothingness and non-being is not necessarily a void, but it's a field of possibility.
Yeah,
And so no thing, as opposed to,
yeah,
nothingness as a void.
yeah.
It's just not a thing that can be tangible, but it's a field of, well, possibility and potential. Um, in any case, that might be a discussion for the future. Um, do you have a favorite philosopher?
Um, Oh, I'm bouncing around. I'm trying to remember the name. I think that there's some of the more contemporary ones that I'm blocking on it now. Um, so I'll just say no for now. I mean,
Okay.
there's certainly the existentialists, Husserl, Heidegger. I mean,
Mm,
in that kind of territory. Aristotle. I mean, who could not love Aristotle?
mm,
So
okay. And top three psychoanalysts or
uh,
influential to your work?
beyond my own analyst,
Sorry? Oh,
beyond.
beyond your own analyst. Right. Yeah.
In honesty, it would have been my training analyst. I
Mm,
think that experience. I mean, how do you learn so much? You have such a deep relationship in that context. But of those that others might know, I
mm,
mean, I think Kernberg to me is one of the more brilliant. I mean, the people that have influenced me. If the question's more on those lines,
yeah.
it would be certainly Kernberg. It would be Bateman and Fonagy and the mentalization kind of arena.
Hmm.
Um, I think getting into the religion piece, I think actually, Bion, although I like so many people, that dabble in Bion or try to
Hmm.
study, he's very hard. He's very
Yeah.
hard intellectually. But and Rizzuto,
Mhm.
I mean Rizzuto in the religion side, but also as a human being and as a psychoanalyst, really. But then I can name so many people I had the privilege of working with in my analytic training
Hmm.
that impacted me deeply. But if someone were to say, what's influencing your practice, and you were conceptualizing, which of the psychoanalytic models to use, it definitely would be Kernberg.
Mm, okay. Do you
Yeah.
like James Grotstein and his
Oh yeah,
work?
yeah,
Yeah.
yeah,
Yeah.
yeah.
I fell in love with his work after I read Beyond, and then I jumped into his work, and I was like, wow, this is.
Yeah, I should have mentioned. I mean, I had some work with Dr. Grotstein. I mean, in
Mm,
terms of consultation, he was at that when I was doing analytic training all those years ago. So certainly,
mm.
I mean, Jim was one of the most brilliant people I ever met.
Oh,
In terms
wow.
of he would talk about himself as being a multilinguist, and he truly was. There wasn't anything in the analytic world that I found that he didn't not only know about, but kind of have an encyclopedic,
Mm,
critical edge to it. So, and yeah, Grotstein's work on projection, projective identification, aligned with Bion and the Kleinians
mm-hmm.
and so forth. Yeah,
Yeah, his work was just so creative and brought in so many different domains. Yeah.
yeah.
Wonderful. Um, yeah, it would have been great to also have him on the podcast. Um,
Oh, yeah, yeah.
then the last question is there any purpose to human life?
Well, you're getting back to the God is meaning in life. Is there the big ones? You're getting the big ones, which I appreciate. Um, Ask it again so I
Yeah.
can.
What is the purpose, if any, of human life?
And my first association goes back to the Baltimore Catechism, so it's a part of me to know, love, and serve God.
Hmm. Okay.
But that's been articulated in different ways. I'm still trying to figure out what the meaning of all this is. What I do know is there's a terrific opportunity in life that I'd like to appreciate more every day. And so ultimately, what is the purpose? It really does. I think I'll just, it does go back to those big questions,
Right.
that that one, in a sense, in that spirit of faithing, I will put my faith in for my instance, within the Christian tradition, with that theological framework.
Mm-hmm.
So that what I said initially, that first association that I learned probably when I was 5 years of age,
Mm-hmm.
still has a certain amount of gravity. That's to the meaning is in part to know to know life and to experience life, and that will lead to its meaningfulness. So it's, but it's above my pay grade.
Okay. Well, thank you so much, Ed. It's such an honor to have you here and to take time out of your busy schedule and on a weekend at that. It really, I really appreciate this, and I'm sure everyone watching is going to appreciate all the knowledge that you've imparted. And
Well, thank you. It's been great to see you again.
mhm,
So enjoyed your book. I thought, whoa, this is sophisticated thinking on so many levels, and that's reflected in these questions. And so it's really great to see you again. I wish you the very best, and to everyone in the audience, it's you know we have such a unique opportunity as we're living our lives to be able to have the privilege of even thinking about these things. Most
mhm,
people on Earth are trying to survive.
mhm, mhm.
So
Yeah,
thank you.
absolutely. Thank you.